Come on, come on. Come on.
Hi, everybody.
Hello.
Hi. Hi.
Just like this. Oh, damn, she's.
Why you get?
How's everybody doing for a Wednesday?
Like the weather.
Oh, it's still snowing here.
Oh, no, it's raining here, so crappy.
Yeah. I'm just gonna jump off for a second. I'm just trying to get finished giving an exam, and I still have one student that's taking the exam. So I'm here, but I need to. Let's see if the student is finished. One second.
Yeah.
not control your strengths. They could not control your proclivities, your tendencies. That was all he said. I designed you unique. Watch this. So catch this. I said this. I am talking about our competence. Yes, we got natural abilities that you're born with and spiritual gifts that are distributed to us by the Holy Spirit.
Hey, if you would all put those of you that are here, put your name and your campus in the chat, that would be fantastic. Okay. Naomi, I can't quite see. Oh, there you are. I was going to say you're in the dark. Renaya, if you could pull your camera down a little bit, I can only see your forehead. How's everybody doing? Happy Wednesday in week 3. Anybody have any questions before we get started? No questions?
I probably do. I just can't remember at the moment.
That's okay. Whenever you do, just Peaches, can you pull your camera down just a little bit? All I can see is your forehead. There we go. Okay. So we are in week 3. Next week is exam week. There are 3 actually there's 2 left. There's 3 reviews this week for exam 1. One has already happened. That was Monday evening with Dr. Ford. And then there's one today with Professor Kershaw. I'm not sure what time you have the schedule. And then I do mine Friday morning.
Oh,
Anybody
is 8 o'clock.
8 o'clock tonight.
Yeah.
Okay. So 8 o'clock tonight is Professor Kershaw's, and then mine is at, I believe, 11 o'clock Friday morning. I've already shared the recording with you guys for Professor Ford's, right? You guys got that. And then I'll share Professor Kershaw's tonight or in the morning, and then you'll have mine. How are we all doing with preparing for exam 1? Have you guys taken a look at the study guide yet?
It started filling it out already.
Okay. Is the study guide, in your opinion, aligning with the class content? For those of you that have looked at it?
Yeah, it seems like it does.
Okay. Okay. And then next week at this time, you guys will be taking the exam, unless you've made arrangements to take it on campus with a proctor, which I have no problem with. You just have to let me know. I've already heard from several students in all of my 4 sections that are taking it on campus with a proctor. You just need to give me a couple of days notice with your proctor's name and contact information, and I'll reach out to them and get them the exam information. Okay, so I have no problem with anybody doing that. What else? What else do we have to go over as far? Anybody have any issues accessing their NCLEX? assignment. Remember, access your NCLEX assignment through your module, through your link. Okay, don't go out and go from, like I said at the beginning of the term, don't go out to www.evolve.com. Do it. You need to start it right through your module. I've already got a couple of, I don't know if it's this class, but I've already gotten a couple of screenshots. Okay, I can't accept a screenshot, and I've sent messages back to those students. I can't accept a screenshot because a screenshot is just the one page, the beginning page, the first page. I need the whole 12-page PDF. So, yeah. What
I
else?
think I downloaded mine as a PDF.
Yeah, they should all be down. If you're going
Okay.
through it through the module, it should be a PDF, no problem. But if you're not going through the module, you're ending up having to send a screenshot, and I can't accept that. So for those who are sending screenshots, I'm reopening the assignment for them to redo and send it as a PDF. Okay.
I have a question.
Yeah, sure.
I don't think I couldn't access mine through the module. I got into the NCLEX because I went into my other course. I couldn't access it from our course.
Is anybody else having the same problem?
Probably not. I'm on the North Campus. We always have issues.
No, no. Does anybody else having the same problem Alfred is having?
Do you know, I don't realize, I didn't think I went in through modules. I think I went in through the regular Evolve to do the questions.
you have to get
And
through
I
Evolve.
took a picture of, I did the PDF. I saved the PDF picture and because it shows everything. And then I plugged it into where it says submit assignment.
Okay.
That's how I did it. I didn't go through the modules because a lot of times when we go through the modules, it doesn't work.
Oh, has anybody gone through the module and it worked for this week?
You know what? I'm not having
Anybody gone through the module to do their assignment?
No, I couldn't go through
Yes,
the
I
module.
did.
Who said yes? Who said yes?
Me.
Do you
Sorry.
have to look at it?
You're going through the NCLEX, right?
For the NCLEX questions, right?
Right.
Yeah,
I
I went through it.
You should be able to click on the module and populate your topics. That's not working. I need to hear from you guys because I need to go in, and I don't need to go in, but I need to put a ticket in to figure out
Or
with
you could go through the website, the actual Evolve website.
But does that
That's what
let
I
you?
do.
Does that let
That's
you?
exactly how I did it. I went directly into their website.
Has anybody clicked on the module and got it done that way?
So the link in the module, I know it didn't work for me.
I'm gonna try to do it now.
Okay. Kendra, try and do that and see if it works, because if that's not working, then we got to get that fixed. And I got to make sure that's not a problem for the future NCLEX assignments.
No, let me see.
No, it just shows you
What
that
to
you have
go
to do. What
yeah,
to
it just
do.
shows it shows you what to click on, what topics to do.
Right.
And then I go to the Evolve website
Okay.
and
So
then
do I.
click on everything that you say to put in and do it that way.
That's
And
Yeah,
that's
it's not a
coming up
hyperlink.
okay? Okay.
It's
Yeah.
not a
Alright.
hyperlink.
Okay. Well, I want to create a hyperlink. That's the way it should be. So, but thanks for the feedback. That's great. Okay. So anybody, take a look at what we're gonna take a look at the readings or the content recording for this week? Do we know what we're talking about?
Yeah, the migrant workers. Ooh,
The vulnerable.
Okay, the migrant workers, the rural population, the poverty and homelessness.
Yep. Okay, great. So all your readings from this week are, so what we're going to do is we're going to review those 4 topics. There's a nice summary in your week 3 notes about those 3 as well. We are going to then take the quiz. We'll take it together. Okay. And then we'll take a look at the HESI prep and we'll just have a interactive, engaging discussion. Okay. I'm going to go to, well, actually, let's talk about migrants. What's a migrant worker? And where are they
Someone that
located?
works seasonally. It's like farm
Farmers.
workers.
Okay. All right.
And they can either work and live wherever they're working, or they're out, and they usually bring families.
Okay.
A lot of them.
Mm-hmm. Where the migrant workers typically come from?
Is it Mexico,
Okay.
Mexico, Haiti, some from the United States.
South America?
Mm-hmm. And so, as we're, let's say you're the community nurse out in the rural community, and part of your responsibility is the farms where these migrants work. What do you foresee as some barriers to this population? Remember, you're in a rural community. What kinds of things might be going on that might be challenging for you that you might have to seek out resources?
Transportation for
Communication.
medical.
Transportation
Medical.
is huge.
Transportation for medical appointments, or
Mm-hmm.
Being able to communicate with them.
Okay, language barriers, potential language barriers, which are very real. Okay.
And are you talking about immigrant or the migrant workers or rural areas? Because rural areas, they might have a hard time really having physicians. They could be understaffed. If the
Absolutely.
physicians choose to leave and go somewhere,
That's
they're not
workforce.
able to.
Those are
and
workforce
they
issues.
have illegal immigrants that stay hidden because they're not legally in the States. So they stay hidden. So they tend to, and their family members, if they're there, tend to get sick and not get help for it.
That's exactly
because
right.
of getting afraid of getting deported.
Right. That's another barrier is immigration status. Right. Another barrier is access to health care. There are some migrant populations that are eligible for health care. Okay, maybe it's subsidized, but maybe they have to pay some out of pocket. A lot of migrants live in poverty, so they don't have those extra funds to purchase their part of their healthcare insurance, right? So, like you just said, they're not going to seek out, kind of like the vulnerable populations, they're not going to seek out primary care services, right? If they have their kids with them, they're not going to seek out pediatric visits, or if they're, and remember the other thing too about healthcare is most migrant workers do not have health plans, or they don't have jobs that provide health insurance, dental insurance, vision insurance, right? So they are paid on an hourly rate, daily rate. So what happens if they have to miss a day of work because they go to a medical appointment?
Am I getting replaced?
They don't get paid, right? So there's reluctance to travel to appointments, fear of missing a day of pay. Okay. And what kinds of healthcare services might we find in a migrant? We use the term, well, rural population, typically migrant population is in the rural community. Okay. So what kinds of exposures? What are their risks, health risks?
Being exposed to pesticides.
Most
because it's a lot of
important.
farming.
Mm-hmm.
Getting bit by snakes while they're working,
Mm-hmm.
working in
Heat-related illness and UTI.
Yep. What about unsanitary conditions? Housing, crowded housing. What is that?
I was trying to say.
Yeah. What is that a breeding ground for?
Oh, illness. Definitely.
Lots of kinds of infectious
Tuberculosis.
diseases,
Yeah.
TB, communicable diseases, right?
Unsanitary water, sitting water.
Mm-hmm. Pesticide exposure is huge with migrant workers. Okay. Let's talk about what would be some primary interventions for a migrant worker? What could you be doing? Remember, what's primary?
Helping them find health
Primary,
insurance.
primary is housing, isn't it?
Finding them. It's trying to prevent something before it happens. So if you're trying to find them housing, what kind of housing you're trying to find them?
Affordable.
Adequate
Mm.
housing that will hopefully minimize the risk of infectious communicable diseases. Right? What other kinds of primary prevention? Elfrida mentioned that pesticide exposure is one of the biggest risks. So what could you do as a primary intervention for this population with regards to pesticide exposures?
Explain to them how you can get it and how to prevent it. Maybe
Exactly.
careful what you drink, what you touch.
Yep.
Even inhale. I heard that even the people living around the surrounding areas, pesticide is in the air. I didn't even know that.
Mm-hmm. Yep. Oh yeah, absolutely. So think about secondary. What happens in secondary? We are assessing for risk, right? Early identification, early intervention. So really with secondary, we've already identified this population to be at risk, right? So we need to teach them and educate them that yes, they are at risk, but how do we kind of stop the exposure in progress from not getting to an actual exposure? Does that make sense? So primary is prevention, secondary is screening. So we're screening them for any kind of pesticide exposure symptoms, right? They may have them, they may not have them. The kids may have them, the adults may not, right? And then trying to intervene with secondary interventions that don't let it progress to an actual exposure, right? And then what's tertiary? What has to happen for it to be a tertiary intervention?
Treatment.
So right? Before treatment, though, what do you have to identify? That they have actually been exposed and they're actually
Diagnosis.
symptomatic, right?
Yeah.
So maybe GI symptoms, right? Maybe some neuro symptoms. So they've actually had an exposure and they're symptomatic. So then it becomes treatment or management of it. Do you guys understand that? Okay, so now we're trying to put our knowledge about migrant populations into clinical practice. Okay, so what do we do? What do we do with the migrant family that comes to your urgent care with a sick child, maybe asthma, and they don't speak the language, and their cultural norms are different? What do we do?
Find an interpreter that can communicate with them.
Okay.
You're probably at that point, they're probably going to ask if they have insurance, and if they don't, they will probably educate them on the resources that's available as far as like social services, so they can go and apply for Medicaid or some kind of assistance to make sure that child's able to be seen.
What kind of resource? Okay, so play that out, Elfreda. Let's say that they live in a real rural community and they don't have interpreter services. I mean, you're the community nurse. Might they have a family member, or even a child that speaks the language better? That maybe you could communicate and have them understand what you're saying? I mean, what I'm trying to get you to think about is the barriers. Okay, because when you're that rural nurse out there, you're pretty much on your own. You may be the school nurse, you may be the OB nurse at the hospital, you may be the immunization nurse, you may be the primary care clinic nurse. All right, so there's not a whole lot of resources out in the rural community. Typically, from your readings, you'll see you have maybe a family practice doctor or primary care doctor. Who knows what their additional experience is in? Is it pediatrics? Is it OB? Is it mental health? Is it substance abuse? Right? Very, very limited resources. And what we find with this particular community is they're very reluctant to seek care. Either they can't afford it, they don't want to take a day off work, they don't want their immunization or immigration status questioned. So when do we typically see them?
When it's very, very bad.
When it's very, very bad. Exactly. And then what's also common about the migrant population as far as where they work? They travel around, right? So there's no continuity of care. There's no consistency of care. They may not know how to make sure their medical records are transferred to the next state. Okay, so they may be starting over in a different state. Right? The kids tend to be sicker, right? Because they're not seeking out primary care, right? Kids may not be up to date on their immunizations. Kids may be actually working out in the farm with them. Kids are very, very at risk if they are out on the farms working with them. They're exposed, well, everybody who's out there, but heat exposure, cold exposure, unsanitary conditions, migrant workers, it's a tough environment. Okay. So let's talk about the differences between, migrants typically work in a rural population. I'm gonna see if I can pull up 1 second. There we are. Okay. I know you can see me, but I just want to go through the readings. Okay. Can you guys still see me? Yes? No?
Yes.
Yes.
All right. All right. So
Yeah.
let's think about this. There's a couple in your readings this week. They're all in the module. Okay. There's no book reading this week. There's four pages of reading in the module. The first one, and I'm just going through migrant to make sure I didn't forget anything. Okay. So due to the physically demanding and intensive nature of their work, what are the health concerns? We just talked about some of them, heat-related illnesses, right? Intensive nature of their work. Okay. Exposure to pesticides and toxic chemicals. We talked about that. Serious health consequences for farm workers. The one thing we didn't mention was injury. Okay. Very high risk for injury, whether it's from equipment or hand tools, and who knows what kind of training they've had. We also talked about urinary tract infections and other infections, lack of unsanitary conditions, lack of toilet facilities where they work on the job. And we also talked about bites from animals, maybe insects, maybe rodents, maybe snakes. And then there's certainly also, we talked about this, susceptible to infectious disease, primarily TB from substandard living conditions. Okay. We talked about the barriers to accessing healthcare. And then the other thing that's very big in this population is mental health issues, including depression. All right, think about it. What are they going through? Constant relocation, right? Poverty, stress, worrying about caring for their family. All right. We started to talk about challenges. This is in your reading, so let's make sure we covered all of these. Prohibitive cost to healthcare. We talked about that. Most migrant families or individuals live in poverty. If they don't qualify, and it shows you in your reading how they qualify. Some qualify, some don't. If they don't qualify for healthcare, they most likely don't have the finances to purchase their own healthcare. Okay, or if they do, Can they afford whatever's left for them to pay from what they're being subsidized for? Shortages of healthcare services. It's really hard to recruit and retain workforce in the rural community. Very hard. All right. So the less healthcare workers you have, the less services you have. I mean, I can tell you if you have a high risk OB, or if you have a specific pediatric issue or oncology, cardiovascular disease, you need to see your cardiologist, those kinds of specialists are not going to be in the rural setting for migrants or for rural populations. We talked about language barriers. Let's see, inability to take sick leave. We talked about that. They're getting paid by the day, right? They have concern of losing paid time work, social isolation, exclusion. And then for undocumented workers, the fear of immigration status. There's a couple of good videos on your link, so check those out. And then the next page was rural populations. So let's talk about rural populations for a minute. A lot of similarities to the migrant population. What might be some differences? I'll start off first by asking the question, why we know why migrants might be hesitant to seek out care. Okay. What about people that live in the rural population? What kinds of barriers do they face in addition to, say, a migrant worker?
They feel like they're going to be judged.
Alyssa, what?
They fear that they're going to be judged, or, you know, they don't want people to know what's wrong with them.
Okay. Anybody want to expand on that? There's one more that begins with an A that's pretty critical to rural communities. The lack of anonymity, which is exactly what Alyssa's talking about. Okay. Similar to the migrant population, rural communities are very tight-knit communities, right? They don't want their business going around. Okay, so whether it may be domestic abuse, whether it may be child abuse, whether it may be substance abuse, alcoholism, domestic situations, they're not going to typically run to the urgent care or the hospital to say, hey, take care of me, right? Because of the fear of lack of anonymity. That's really big in the rural populations. So like the migrants, a lot of times we're not going to see these kids who are abused or domestic abuse. We're not going to see it until it's at a pretty advanced or critical stage, because they don't want everybody knowing their business. Like I say, you, the nurse in the rural community, you may be the urgent care nurse and the school nurse where the kids go to school. Okay. What other challenges does the rural population face?
Is it like a transportation?
Transportation is huge. Yep. What if you have to get down to the cancer center that's 100 miles away for treatment? Transportation is a big issue in the rural populations. So therefore, unless it's really, really bad, they may not travel down. The other question I have that's covered on the exam, but in a different way, it's about motivation. Okay, so rural population communities aren't very motivated to take care of themselves. That's just in general. Okay, they just aren't. What can we do? Let's say you're conducting a health fair and you want to communicate to the rural population how important primary care is, because they're not really interested in primary care, right? They're just not. How do you motivate them to be interested in primary care? Primary services, prevention. What do you do?
State the consequences?
What?
Can you state the consequences?
Do they understand their disease? Do they understand what's going on?
I was going to say education.
Mm-hmm.
Because if they don't know, it could turn out bad. They just keep letting it go.
Exactly. And my other class the other day said, well, we'll bring them food and we'll get them there free and we'll give them prizes and have a
Oh,
drawing.
incentivizing it.
That's all great. That's all great. But what's more important is that they understand the current condition of their health. They understand why blood pressure screening is important. They understand why diabetes screening is important. So it's one thing to give them freebies, but much more critical is having them understand that if they don't catch conditions or diseases in the early stages, the long-term outcome presents more risks. So how do you motivate them to help them understand the importance of primary and maybe some secondary screening? You're going to get asked about this. So we need to have a discussion on motivation in the rural community. What if you set up this health fair and you bring in doctors from, the hospital that's 100 miles away, or you bring in, diabetic nurses from a diabetic care center 100 miles away, nobody shows up. How do you motivate them? Let's talk about that.
Putting out examples of what could happen, kind of
Okay.
fearing them into coming.
They take it seriously. If you've already screened them and they're at risk for high blood pressure, maybe reviewing the long-term effects of high blood pressure are potential health outcomes, potential health risks. So your goal is to get them to this health fair or whatever you're putting together. Because the health of rural communities is usually not that great. And if your goal as a community nurse is to improve the healthcare of the community, it starts with education. What else would you do? You're the rural nurse. What else do you do?
Talk to people that you know, spread it around, give information about it that way.
Anybody else? Oops. I want to make sure I've covered everything in here. Some of the same barriers apply. Financial means to pay for services, transportation issues, lack of specialized services, right? A lot of times rural community or rural clients have difficulty communicating with their healthcare providers. They don't know what to say. They don't know what information to present. They may not speak the language. And then we talked about privacy. Literacy is important too. What is the difference between health literacy and health illiteracy? I don't mean illiterate in general or with regards to health. What is the differences? Health literacy and health illiteracy.
Just being knowledgeable.
Yeah, understanding health and those who don't understand exactly what it is.
Understanding diagnosis, understanding treatment plan, understanding follow-up appointments. That's real difficult in the rural community. And then what about the stigma? Is there a stigma associated with rural communities? And what are those stigmas?
I feel like it's like basically like they have like lack of resources. Like they don't have really much
right
around. Barely stores, barely any type of like, like we have groceries, different food places. They don't have that.
What are some stigmas associated with the rural communities?
drug users
Pardon
probably
me?
having mental issues. Drug users and mental illnesses and
That's exactly right.
underlying illnesses already.
And even though it's a stigma, mental health, substance abuse, those are real problems in the stigma or not, those are real problems in the rural communities. We
I
talked
think
about, go ahead.
I was thinking more so with the rural community that's here in Pennsylvania with the Amish, more so with cultural and also
Mhm.
religious.
Yep. Yep. What about internet? Is that a problem? Potential problem in rural communities?
Yes, in rural
Of course.
communities, they don't have great connections depending on where they are, or no connection at all.
Right. Or very little.
And,
Yolanda
and
in
satellite
go ahead.
satellite internet for the rural communities can tend to be way more expensive than like BIOS or Comcast.
Yeah.
And what if you want to set up, hey, can you guys, Kendra and Yolanda, turn your cameras on, please? What happens
My
when
camera is off?
Yeah.
Oh, sorry.
That's okay. That's okay.
I thought I hid my microphone off.
Okay. I'm the camera enforcer, I guess. I lost my train of thought. Oh, so without internet, if one of the goals of accessing healthcare from a rural community is telehealth,
Telehealth.
what challenges does that present when you have limited internet?
You
What
can't
about
do
a
telehealth.
Can't get on.
Yeah.
You can't get on, or it gets cut off, interrupted. You know.
What about the home health nurse that needs to do visits in the rural community, or the hospice nurse that needs to provide end of life care? You're talking lots of challenges: transportation to and from, reimbursement. Maybe if the internet's not great, how do you communicate with your physicians and your other members of your healthcare team?
Charting while you're there.
So the message here is the challenges that the rural community faces. Part of that rural community might be the migrant worker, or the vulnerable population of that rural community. One of them may be the migrant worker. One of them might be kids. Kids typically in the rural communities are sicker. They tend to have more academic and behavioral issues in the schools. And this is all from your reading. Okay. They may start developing chronic diseases early on because of the lack of healthcare access or services they might have. Right? What else do we want to think about with rules? Let me just make sure we talked about workforce shortages, we talked with health insurance coverage, internet literacy, social stigma, privacy issues. We talked with issues with home health, hospice, mental health services. So we pretty
Hospital
much covered
closings.
hospital closings. What happens when hospitals close? Less services. The services just decreased. There's a huge push, and at the end of your page of your reading in your module, there's a dozen resources, agencies, foundations that are all working on better access for rural communities for healthcare. Lots of people, lots of companies, agencies working on that. Rural communities are starting to link with larger hospital organizations, which is good. Partnering with larger organizations that may be in the next town or the next county or the next state. Okay, so lots of things are being done, but we do address rural community nursing in this class because that's part of community nursing. Just like a school nurse or a home health nurse or a hospice nurse, there's also a rural community nurse. I mean, can you imagine being out there all by yourself? You're the nurse out there and dealing with all age groups across the lifespan, with limited resources. You know, your next second opinion may be a phone call of a doctor who's 200 miles away. Okay. And the other vulnerable group I forgot to mention in the rural population is OB, high-risk OB, high-risk babies. We know that in the rural population, the chances of increased preterm birth, increase in morbidity and mortality, that's a fact in the rural communities. Okay, so what, who knows? I mean, do they have the neonatal support when the babies are born? Highly unlikely they're going to have a NICU. Okay. Next topic I want to cover is homelessness. Does anybody in the communities you live in now, does anybody not have any homeless people living in your community? What do you think about? What do you think about when you're driving down the street or driving or walking and you see homeless person or a homeless encampment or a homeless family? What do you guys think about?
Did they eat?
Pardon me?
Have they eaten?
What
How
else
did
do
they
you think?
get there?
Yep.
They get there.
Yep.
What else? Does anybody work with the homeless population?
Mm-mm.
I mean, I've come across people who you don't even think are homeless, but a lot of people can mask their homelessness very well because they still are clean, they still have a normal appearance to them. So because I've gone to school with people that were homeless, I've been homeless myself, and I've also maintained my health and I've maintained my overall look. So to say that there's a certain look and a certain way about somebody that's homeless is very variable. It's variable. So
Mm-hmm. I agree.
Yeah, when I worked in the schools over the last 20 years, I can honestly say in the last 2 years during the pandemic, and the national statistics support this, there's been a very high percentage of families that are now homeless that were not. Okay. And I only know this because of the kids in the schools. There's been, I think, a 30% increase. I think the statistics saying you're reading that over 600,000 people may be homeless on any given night, and 1/3 of that number are families. And homelessness is defined as not having a permanent house. Okay. So if you're living obviously, if you're living on the street or in your car, obviously you're considered homeless, but homeless even covers, let's say a
Bouncing
family.
from house to house.
Yeah, exactly. Bouncing from house to house,
From friends and families.
living with friends and family. That's considered homeless.
Yeah, I did that for 2 years. I bounced around.
Yeah. Yeah. What do we know about the homeless population? We know it crosses all economic levels, right? We know it crosses all career paths. We know it's men, we know it's women, we know it's children, we know it's every ethnicity.
All ethnicities.
All ethnicities. Yep. What else do we know? Because if you work in community health, public health, you will be working with the homeless population, whether it's they present to you at a facility or whether you're working with them out on the streets or whether you're working in visiting a shelter.
They're high risk for communicable diseases. They usually prolong getting health care just because if they have children, they don't want to stay away from their children for too long, or they may have their belongings in a certain space, certain shelters. you can't keep your things in a shelter for too long because they may throw it out. So they don't want to leave their things there and then come back and not have their like belongings or whatever the case may be.
Mhm.
Have their children taken away. That's the other one.
Big,
So they're
big concern of homeless families. Hmm.
A high percentage of them have mental illnesses that aren't treated.
Hmm. And their mental illness may be a comorbidity with something else. A lot of homeless people are homeless because maybe a disability from work or an accident, and they can't get employed.
veterans.
Veterans are huge. Who are our homeless populations? Veterans? Who else?
Veterans, a lot of people with mental
Drug
health.
addicts.
Mental health, drug addicts.
People who suffer from domestic abuse.
Mm-hmm.
Being in Philadelphia, and
Teenagers.
it's a what is it called? One of those cities where they were sending illegal immigrants. I noticed a lot of illegal immigrants are now homeless, a part of the homeless population here.
And teens, like especially like where my mom, the area my mom lived, it's a shelter for teens, but I guess because of the amount of beds they have and their limited space, it's a lot of teens that are homeless that I didn't even notice until I asked about it.
Yeah. What about pregnant teens?
I would think that with pregnant teens, because they are pregnant,
or pregnant
it gives-
homeless teens.
I don't know. I always thought that they would have like more resources or like, more of an advantage to get help being as though they're pregnant.
If they're homeless though.
Yeah, that's what I'm saying. Like if they're homeless, they have more advantage of getting them resources because maybe people might see them as a priority.
Mm-hmm. As a vulnerable homelessness is a vulnerable population anyway, but teen pregnancy is also a vulnerable population, just in general, irregardless if they're homeless or not. As you start to work with, let's say you're working with homeless people, what's important at the beginning? How do you make initial contact with these people, and how do you help them?
You have to gain their trust first.
And how do you do that?
Because therapeutic communication. Listen.
Demonstrate that you're genuinely interested in them and hearing about what they've been through.
Be non-judgmental.
Yep.
You want to help them with resources and everything.
Mm-hmm. Well, let's say you're working with a homeless family and the mom is also a victim of domestic abuse. It's going to take some therapeutic communication to convince her to trust you so that you can start scheduling appointments for whatever, for the kids, for her.
Even go back.
Right? Otherwise, they're just not going to want to participate if they don't trust you. Okay, they're already in an extremely difficult situation. Then they have somebody that they don't know that's come out of nowhere, this community nurse who's poking around and asking questions, and the initial contact with a homeless person or homeless family is critical, and that's talked about in your reading. Okay, let's see. Just want to make sure I'm covering. I'm just looking at your reading. Talked about and homeless populations as well are not it's not, if you're talking about demographics, it's not equally spread across the country. There are certain areas of the country that have a higher risk of or higher homelessness population.
The South.
Yep. And there's great visuals and tables in your reading page for homelessness. Okay, so we talk about the risk factors. We just talked about the initial approach. Read that section. Clinical and medical conditions. Typically, they already have a history. Chronic diseases are very common in the homelessness population, especially cardiovascular disease. And we talked about dual diagnosis, comorbidities with mental illness and substance abuse. They may have cognitive disorders, may have a TBI that they're dealing with, and then injuries and violence. Domestic violence occurs regularly within the homeless population. Why? Who knows? Anxiety, post-traumatic stress disorder, major depression. Okay. And it kind of like the rural population, preventative health measures, health examinations, immunization, that's not their priority. They're just trying to survive. Right? That's why homeless children are very at risk. What are they at risk for? Lack of health care, lack of education, maybe lack of nutrition.
But
At risk for violence, child abuse. And think about if you're a homeless family and you have a preschooler, an elementary schooler, a middle schooler, a high schooler. They're all going to react to this situation in different ways. So what are their developmental needs for homeless at their different ages? They're much more at risk for skin conditions. Why? Heat exposure, cold exposure, frostbite. Hey, what else about homelessness? Many of you selected homelessness in your week 1 discussion question. Many of the vulnerable populations assignments that my students do for PN, it's due in week 10. Many of them choose homelessness in their community because they want to know about it. Okay, because none of us live in a community that does not have a homeless population. Some of us may have more than others. Okay, so if you did your discussion 1 on homeless population and you want to, you've already done some research because of that discussion question. And if that's something you want to continue with, do your vulnerable population assignment on that population, on the homelessness in your community, because you already have kind of a head start. Okay. I have a lot of people that do their vulnerable populations assignments on the homeless. Okay. And homelessness is increasing, right? It's not decreasing. It's increasing in every community. So, and then the last part of our reading was poverty. What effects does poverty have on an individual, on a family, on a community?
It has stress. It can cause well, just overall stress, mental stress, health stress, just a lot of issues.
So for purposes of this class, we describe the financially strained family living in poverty as one of the most prevalent problems for families to access anything, whether it's good nutrition, good education, good health care. The financial instability of a family is directly related to the health of the family. Would you agree? Many people, many families live in poverty. And we're going to be, you will be working with a lot of families in poverty in your communities. How do you find them the resources they need? I have a friend of mine who's a nurse who works, volunteers at the local food bank. And I live in a pretty big community. She said their shelves are empty. Empty. They can't get things in fast enough. Okay.
I know, like with families and poverty, I was watching this documentary, and it actually breaks families up because for like PHA, I don't know if it's the same, but I knew at the time, PHA, in order for you to keep your PHA or have the food stamps or cash assistance, like the father couldn't be present. So a lot of fathers or mother were parting from the father so that they can be able to receive them resources. So I feel like when you're in poverty, it you develop mental issues as well, like depression, anxiety, because now like your family was just together, but in order for you guys to live like uh somewhat of a
Above
sustainable
the
life, you'll
poverty
have to
line.
bridge off. Yeah,
I don't know,
you
Keandre.
you gotta
That's true,
break
yeah.
apart.
That's true because when my mom first came to America, she was able to purchase a house and she applied for food stamps. But in order for her to remain on food stamps and also to receive medical benefits for me and my brothers and sisters, she had to sign her house over to my dad's mother. And now she doesn't have control of the house anymore because they bamboozled her out of the whole situation. But for a long time, throughout the 80s and the 90s, you couldn't have any type of like asset in order to be on benefits.
Yeah.
And it's really corny.
It's still the same. There are some benefits that if you have any kind of asset, they somehow find a way so it offsets in their benefit. I've noticed, like living in housing, they make it hard for you to be able to move forward.
Mm-hmm. They want
Anytime
you to
if you
stay
have any kind
still.
of financial income, yep, they want you to stay. I'm like, this is supposed to be, I'm like, when I owned my house, I paid the taxes. This is supposed to help people so they can move forward, not hold
Mm-hmm.
them back and keep them in the system. People want to get out of the system,
Yeah.
you know, and you can't have $5 and they want to know about the $5.
Right.
And when the $5 makes your food stamps go down, makes your rent
Mm-hmm.
go up. And I'm
And a
like,
lot
so
of people now are wanting to work, have jobs
yeah,
that pay under the table. Because
exactly.
if
Trying to
you
get
like,
ahead.
when I first started nursing school, they took my childcare. And I'm like, I don't understand. And they're like, well, you don't work the hours to receive childcare, but I'm currently in school, and it's just
You're a
like you
full-time
kind of
student.
literally it's either you have to make a choice if you really want to sacrifice for a little
Yeah.
bit and struggle and develop all that
It's a catch
the mental
22.
illnesses and stuff, or do you want to just stay where you at? No, it's working for me right now. I got the childcare, so it's a lot.
Mhm.
It's a
How,
catch
how is
22 when it comes to that.
how is childcare? I mean, how is poverty defined? Or how do you assess poverty levels? The
You
federal
can go,
government does that, right?
mm-hmm.
By establishing poverty guidelines, whether it's
Mhm.
single or family of 2, 4, single, married. It's all figured out for you,
And that's
right?
where I said, like with the
Yeah.
cash thing, like
Mhm.
you and the father, or the father and the mother, whoever got custody of the child,
Mhm.
but if you want to get cash assistance because, okay, I'm in school right now, I want to go get the cash assistance to help me do a little bit of my part right now. It's just like they're telling you, no, you're going to take the dad to court and he's going to give you this, but it's going to go to us and we're still going to give you this amount.
Yeah. You have to, they take 30% of whatever you get. So they take 30%. Food stamps takes their percentage. So whatever little bit is like people on Social Security, whatever they gained this year as their increase that everybody got, somehow housing and the food stamps, they work it so they get whatever raise you got, and you're right back in the position.
So so you're the community nurse, and you're in a community that has a high level of unemployment, a high level of poverty, maybe a high increased crime rates. How do you help those people? How do you help those families in poverty? What do you do?
Well, I do know that I used to volunteer at the shelter off the shelter off of Stanton Avenue around the Germantown area of Philadelphia, and they do help families together, but it got to be this. It got to be that.
Mhm.
You got to be this. You got to be that. And if you are that, okay, yeah, we're going to help you. But now we're going to bring social services into it because now, because of all these things, you need further. I have to involve. It's part of my job to report, and you have to get social services involved. So I don't know. Like, I feel like with that, not saying that it's no way for us to help them, but I feel like it's always a twist. Like we're doing more damage than actually helping.
Mhm.
So that's an excellent point.
Excuse me.
So
Excuse me,
think about
Professor
it.
Marlowe.
Go.
Uh, Armani wanted me to let you know that she got booted off and she's trying to get back in.
Okay. I don't have her in the waiting room. I don't see her yet. Oh, there she is. There she is. I just got her in. So with what Keandra just said, think about the challenges of a community nurse working in the community with all the families, all the individuals that live in poverty. And there's a lot. Think about those challenges you have with your role in the community. Think about all the people, all the resources that these families and individuals need. It's tough. It's tough. Okay, so that's why I keep telling you, working out in the community is a whole lot different than working in the urgent care or the hospital. It's very, very different. Lots of vulnerable populations, lots of vulnerable people, whether they're living in poverty, whether they're homeless, and then transition that into the rural population, which comes with a whole new set of challenges. Okay? It's tough. It's tough. Does anybody, that's a review of our topics for today. I want to go to the quiz. Can everybody pull up their exam, or excuse me, their week 2 quiz?
Marla, I have a question.
Yeah.
Sorry, I ran into
Oh, that's okay. Go ahead. Go ahead.
Go ahead.
Regarding the exam, because I remember last term when we took exams in the class, they wanted like a whole bunch of details that I just. Are you gonna require the same? Like they wanted us to sign in on Zoom on our phone and then.
Oh yeah. Yeah.
Yeah.
Well, I mean, what are you guys doing in your other classes? Nothing's changed with the exams.
I always went on campus because they made it a little too difficult.
Oh, well,
Yeah,
you can go to
usually on-
campus.
Usually on campus, we have like somebody, one of the teachers there proctor us.
That's fine. That's perfectly fine. I think I sent out a message about that. I have no problem with you guys taking your exams on campus at all. I already have several students doing it. In fact, I
so
think
Essington, we proctoring.
What?
Essington, are we proctoring?
We proctoring.
Okay.
Whatever you want to do. You just need to get me.
Meet me at the school.
I know previously with my Centerville campus, I had like 11 students in the Centerville campus last term, and they all proctored with the same person, and they did it for all 3 exams, and it was fine. There's just there's a few things though. You got to let me know at least a couple of days ahead of time who your proctor is, okay, so that I can reach out to that proctor and give them the exam information, like the passcode and all of that kind of stuff.
Yes, you got it.
Yeah.
Well, I think it would go like
Yes, you got
directly
it.
to our dean anyway, and she
What?
gives it out.
No, I need to know who's the proctor and what students are participating. I need to hear from every student if you're going to participate in the proctoring on campus.
Okay, we'll send you an email tomorrow.
Yeah, I have no problem with that. I have
Thank
no
you.
problem with that. Yes, Chris. Oh, I thought you had your hand up. Yeah, I have lots of students who do that. There's just a couple of steps we need to follow.
That's fine.
Okay.
Yeah, we usually did that. So I'll send an email tomorrow with the proctor.
Yeah.
Thanks.
And then whoever's going to do it, let me know. That's fine. Okay, everybody have quiz 2 pulled up. Okay. All right, who wants to read question 1?
I'll do it.
Go ahead.
What should the home health nurse anticipate about the client in a very rural community? A, they will be more likely to have complex chronic illness. B, most of them will have employer provided insurance. C, they will be less likely to have environmental chemical exposure. Or D, most of them will have adequate access to a physician.
What's the right answer?
A?
Hey,
Absolutely A. We just talked about that. And B, C, and D are all exactly the opposite. They're less likely to have employer provided insurance. They are more likely to have chemical exposure, environmental chemical exposures, and they will have less access to physicians. Right? That's what we've been talking about for the last hour, the last half hour, first half hour. Okay, so A is your right answer.
Question number 2, the nurse is developing a primary prevention program for members of a rural community. Which intervention is appropriate? A, encourage adherence to routine pap smear schedule. B, provide information on minimizing excessive sun exposure. C, educate families on diabetes-related foot care. Or D, organize a blood pressure screening at the local mall.
What's the right answer?
B.
I would say organize the blood pressure
That's-
screening.
screening is second.
Be
I think it would be
careful.
sun
Because
exposure.
Oh, wait a minute,
C
wait a minute.
is prevention.
Yeah, primary
Would
is
be the
prevention
sun exposure.
before.
Mm.
And the
Or
routine pap
educate.
smear.
Okay, why is A wrong? Encourage adherence to routine pap smear.
Because that
It's
would
secondary.
indicate that they've had it before and that they've
Okay.
already been treated or
Okay, so
I
it's
don't know.
screening,
Yeah,
right?
right.
Why is
Oh,
C-
gotcha.
Why is C wrong? What's C?
Educating
you already
families on
have it, right?
diabetes-related foot care. They've already been diagnosed, so they're in
Correct.
Yeah.
And that's a requirement for tertiary interventions is they already have to
Right.
have something. So if you're teaching on diabetes related foot care, they already have it,
So B.
right? B's the right answer. Why is C wrong? Excuse
Screening.
me, why is D wrong?
Screening.
Because it's
Screening.
Secondary.
Because it's screening, it's secondary. So B, why is B the right answer?
It's
Because
preventing something.
Because it's
provide
information to prevent.
Information.
Exactly. Yep. Good job.
I hate when you go away. Where'd it go?
All right. Can you guys still see me?
no, I'm looking at my quiz screens. I can't look at both.
Yeah, I
Oh, that's fine. That's fine.
do the minute scroll.
Okay, somebody
So I have
somebody
to
do number
copy back
3.
up.
Somebody do number 3.
A migrant farm worker presents to the migrant outreach clinic complaining of bilateral eye irritation, throat irritation, and cough.
Keep going. Which nursing intervention is appropriate?
What's the ask? Which nursing intervention is appropriate? A, evaluate other family members for signs of conjunctivitis. B, ask the farm worker if they apply chemical pesticides at work. C, request a physician's order for an antihistamine. Or D, complete the tuberculosis symptom screening questionnaire.
B.
B.
yeah.
You guys saying B as in boy or D as in dog?
B as in
B
boy.
as in boy.
Okay.
It
Why is
says
A wrong?
intervention.
Why is A wrong?
Conjunctivitis.
Conjunctivitis wouldn't cause throat irritation and a cough. It's just
Thank
the
you.
infection of the eye.
Thank you. Why is C wrong?
Because you're assuming that it's
Allergies.
Allergies.
Correct. What about D? Why is that wrong?
Assuming again.
that's diagnosed already.
Mm-hmm.
Those aren't signs of tuberculosis.
Correct.
Nope.
So
That is signs of pesticides.
think of the nursing process.
Chemicals.
Yeah, think of the nursing process. What do we do first? Assessment. So that's a good question on the assessment front, right?
Oh, this is gonna get me. Ugh.
Okay, number 4. Somebody read number 4.
During a home visit, the nurse knows that a migrant farm worker family is living in a small house with several other families. Which nursing assessment is priority? Assess to and consumption of nutrient dense foods. B, ability to travel into town for healthcare services. C, history of y'all know, what's that say?
Gastroesophageal.
Reflex disease or tuberculosis symptom screening questionnaire.
Okay, before you guys start answering, what was the key word in the question?
Assessment.
Nope.
Priority.
Oh, priority.
Priority. Okay. So what is the what does the question give us? What information does the question give us?
It's a migrant farm worker.
It's letting us know that the nurse is doing a home visit.
It's a small house with a
So
lot
if the
of
nurse is
people.
doing a home visit, then
In a
they
small house with a
probably
lot of
don't
people.
have access to go to the hospital or whatever.
Okay. If migrant farm worker family is living in a small house with several other families, what are they at high risk for?
Tuberculosis.
So what would be the right answer?
D.
Mhm. This is a perfect example of looking at a question and you look and say, all those answers are kind of in the ballpark. They're all looking pretty in the ballpark. Well, did I miss a word in the question that might reduce the number of answers that could be correct? And I go back and read the question, it says priority. Does that make sense?
It does.
That's a perfect example of, I don't know, all these could have some relation, but what's the priority? Well, the fact that they gave you the information that they're migrant workers, number one, they're living in a small house, number two, several other families, number three, very crowded conditions. What did we learn from those three things? That they might be at higher risk, they are at higher risk for TB. So what's
Because
the
of how it's
priority?
contracted. Yeah.
First and foremost, let's do a screening questionnaire. We can deal with all the other three things down the road, but it asked about a priority. Okay? And that's what you have to do on your exam questions. If all the answers look the same and there's only one correct answer, you miss something.
That's like the Kaplan's rules.
Okay? Okay. Somebody read number 5.
Which statement reflects the impact of income on health outcomes?
We just talked about that.
Low income increases the risk of chronic illness.
Yep.
C.
Why?
Because they wait till last minute when it's too late.
And if they
Yeah.
have low income, they're less likely to have insurance.
Yep.
Yes.
Number 1 is not necessarily true. Number 2 is the opposite. And number 3 is the opposite. Right?
Number 4 is the opposite.
I mean, number 4, yeah, I guess it could, but for purposes of this class, we don't say that high income does not improve health outcomes. Okay, it may not, but that's not the right answer anyway. Okay, it's C. Low income increases the risk of chronic illness. We've talked about that for the last 3 weeks. Okay, this is kind of a tricky question. We always have some good debate about this. Somebody tackle number 6, please.
What should the nurse anticipate for a family living just above the federal defined poverty line? A, increased vulnerability due to fewer community resources. B, improved health outcomes compared to those in poverty. C, reduced vulnerability due to employer provided insurance. Or D, unchanged health outcomes compared to other income levels.
So what's the important phrase in the question?
Poverty line.
Anticipate.
Just above the poverty
line.
Just
To
above,
me,
yeah.
to me,
Oh, I
just
see it now.
yeah, to me, just above the poverty line means
No, improved.
Improved health outcomes.
right. So let's see. So what's the right answer?
B.
First off, you just gotta mute your computer because it's gonna be it's an echo.
What? So the correct
One of y'all
answer,
gotta mute.
I think it's A.
yeah, wouldn't they
I'm gonna
have an
say Yeah, I said A because if they're just above the poverty line, remember we
They're gonna
discussed
lose
that.
benefits.
They're gonna lose. They're gonna lose some things.
Which makes them what? Vulnerable
Vulnerable.
Mm-hmm.
to having access to fewer resources,
Mhm.
right? I
Okay,
think
we got
B's a
this.
stretch. B's too much of a stretch. If they're just above the poverty line, improved health outcomes compared to those in poverty, well, they're right at the line. So I think B's a stretch,
Mm.
right? Reduce vulnerability due to employer provided insurance. Why is that incorrect? Because they're less likely to have insurance, right? Much less likely to have insurance.
Right.
Okay. And then D doesn't even make any sense. So, okay. Okay. Give it your best shot on this one.
Which client is at the highest risk for adverse health outcomes related to poverty? A, 15-month-old infant without medical history, 19-year-old male with history of asthma, 68-year-old female with type 2 diabetes mellitus, or D, 44-year-old male working on a farm. That's a tricky one.
Who's most
I
at
would say the
risk?
68-year-old.
I feel like the baby is the most vulnerable. They don't even have a
Baby with
commitment.
no medical history, or
The
the
only one that says
44-year-old
anything
the
about
farm.
their income is the farm one. So I would say
Yeah. I'm between the first one and the farm.
Because it says outcomes related to poverty. So
keep talking through it.
If the outcome is related to poverty, who's going to be the most at risk?
15-year-old, 15-month-old.
Why is the 15-month-old most at risk in this scenario?
They don't have an immune system. They can't fight anything.
They
and they
don't
also
have any.
can't communicate as with you to let you know
what their needs are.
What their needs are.
Well, this also, yes. And this also tells me that this 15-month-old doesn't have any kind of medical history. Maybe they haven't been seen by a doctor. They, who knows? Who knows what's going on? So this baby's, because of living in poverty, is at a very high risk for vulnerability if there's no medical history at 15 months. I mean, not to say that the 44-year-old male working on a farm is not at risk, but this answer doesn't indicate that there's something wrong yet. Where potentially without a medical history at 15 months, that's telling me that's more of a priority than the 44-year-old male working on a farm. Not everybody gets sick from pesticide exposure. Not everybody gets sick that works on a farm, right? So the answer is the 15-month-old. Okay. Question 8. Go.
Which would the school nurse expect for impoverished adolescents? A, reduced risk of unintended pregnancy, increased risk for hold on. What? Hold on. Increased risk of dropping out of school. C, excellent use of adaptive coping mechanisms, or D, improved attendance to extracurricular activities.
Okay.
We know C and D is out of the picture.
Increased risk for dropping
Yeah,
out.
B.
Why is that the correct answer? What are we
Because
talking
they go
about?
to younger generations that are old enough to work. The minute that they could go to work, they drop out of school because to help the family, parents, siblings get money so they could get food.
And I was just thinking about like real life situations. Like, you know, I know a lot of people who drop out of school because they want to help their family or want to help their mom, you know, around the house or whatever.
Right.
So let's put this in perspective. Okay.
Oh, it's going to be the pregnant lady.
Exactly. Adolescents, especially teen pregnant adolescents. The biggest risk they have other risks, nutrition, getting transportation to prenatal visits, all that. But one of their biggest risks is dropping out of school. It is well known that if they can continue with their education, even if it's a high school degree, the better educated they are, the better outcome they will have, as will the baby.
So we're
Does it-
saying the
does that
answer
make
is
sense?
actually A.
The answer is, I thought
Yeah.
it's B.
Right.
Oh, it's B.
Okay,
It is
yeah, I was about
B.
to say.
That's
You're
just
right,
it's
Bianca.
like-
It's at
It's B.
reduced risk.
That's what I was saying. I was so confused on how it would be A.
I'm sorry. Hang on.
Oh,
I know, right?
reduced. I'm
It's
looking
an
at reduced
increased
wrong.
risk. A would be the opposite.
Increase.
Increased
That's
risk,
reduced.
right?
That's why I gotta slow down.
Right? But B is the right answer. Increased risk of dropping out of school. If there's anything we can do, let's say you get a question on the exam that says, what is the most important intervention with a teen pregnant mom? What is a priority intervention? Priority intervention of a teen pregnant mom that you're working with in the community. A, get her to prenatal visits. B, make sure she's eating healthy. C, make sure she stays in school. D, make sure her parents are on board or support. What's the answer?
I forgot. Just that fast.
The education. All the other answers are correct, but what's
But
the
the best
priority?
answer.
In your reading, it clearly states that keeping these kids in school is the most important thing. We can get them to their
Education.
prenatal visits. We can get them, educate them on how to eat healthy, talk with their support systems, but trying to keep them in school is the most important because there's a direct relation of education and better outcomes. And I don't mean going on to college, and I mean just staying in school and at least even getting their high school diploma. Does that make sense?
It does.
Okay. All right, number 9.
Which client is at highest risk for homelessness? Adolescents with substance addiction and supportive family, veterans with post-traumatic stress disorder living alone, adults with schizophrenia living in a group home setting, older children with a history of suicide ideations. I would think it would be
Veteran.
out of C or B and
veteran.
C.
What's the
Yeah, I
what's
think
the
it's a
important?
veteran.
Say the veteran.
Why?
I say it's 1.
Because half
I
the
say
homeless
it's
people out there are veterans.
He's
What are the
living
two
alone.
what are the two concerning things about the veteran?
The PTSD and living
PTSD and
alone.
living alone.
And
So he
living
doesn't have
alone?
anybody to
You're
help
gonna
him
have
cope.
a severe mental status right there.
Exactly. And
No,
what
no
is the
support.
and what is the important phrase in the question?
Highest risk.
Highest
Exactly.
risk for homelessness.
So all these could be risk. All these have
Mhm.
risks, right? The A, C, and D. They all have risk, but which has the highest risk? So again, this would be a good question if you got to, and you read it and you said, everybody seems to be at risk here in all these 4 scenarios. Please go back and read the question. What word did you miss? Highest. Okay. Number 10.
The nurse is working in an outreach clinic at a homeless shelter. Which client should be prioritized?
Ooh, what's that big word?
Prioritized.
Prioritize. Okay, go ahead.
So we have A, complaints of night sweats and unexplained weight loss. B, worsening foot ulcer with purulent drainage and erythema. C, frequent urination with constant hunger and thirst. They probably got diabetes. Or D, difficulty sleeping at night due to panic attacks.
Okay.
Who should we prioritize?
That foot
The
also.
worsening foot ulcer with the purulent drainage and
Erythema.
High risk for infection, and he'll
Why?
probably lose that foot.
Yep, there
Yeah.
you go.
Mhm.
Prioritize. Not that any of these 4 couldn't
They're all bad.
be. They're all bad. But what's the worst?
And that foot's
Him, because he could lose his foot.
The foot ulcer is the worst.
Yepers. How'd you do?
Hold on. You said
I'm-
what was the
I'm
answer for number 10?
Complaints of night sweats.
Man,
Yeah,
it's complaints of night
unexplained.
sweats. I just got a 9 out of 10.
I remember
Well,
that
you know
from
what?
Monday.
I thought it
Yes,
was the
yes,
one with night
yes.
sweat because
Yes,
I
that-
thought it might have been TB.
That's the correct
So
answer.
what? Wait a minute. What was the answer?
The correct
Night
sorry,
sweats.
the correct answer is A. B was supposed to be taken out this term. It didn't get taken out by the
Oh.
curriculum team. So why is A the priority?
Because they symptoms of TB.
That's also
Don't worry about
diabetes.
don't worry
Right,
about
but
your
that's
nines. Don't worry
right, but
about your
that's
nines. I'll take
that,
care
that's
of
a
it.
hard choice because remember the foot ulcer is getting worse.
Yeah,
And
it's
then we see the
purulent.
Yeah,
purulent
but
drainage
TB
and we
is
see
But
more.
that
we
It's
know
more.
we know what it is with the foot ulcer, with the unexplained weight loss. We don't have a clue what that's for, what
Yeah,
that's
that's
about.
In
that's
a
a
nice
hard choice.
way.
We get the points.
So
Hey,
don't worry about your
Six.
don't worry about your
So
nines.
is 6
I'll take care
reduced?
of them.
Is 6 number 3?
What?
Question number 6. Is it 3? Is it C?
What's the question?
Which should the nurse anticipate for family living just above the federally defined poverty line? Because I
It
couldn't
was
quite hear.
A.
It was a lot of. It was A. Okay, I heard echoing. That's why I couldn't get it. Okay, thank you.
So I'll get all your nines to attends. Don't worry about it. I have to get that answer. I either have to get A out of there or B out of there.
Yeah.
So anyway, helpful to go through the quiz like that.
Very.
Yes. Very.
Very.
Because it's helping
I
me
wish we could go through
answer.
the exam like that.
The rationale is amazing.
Yes.
Well, I do go
I
through the
appreciate
study
the
guide pretty
rationale.
heavily on Fridays. So
We'll be there. Well, I'll be there.
the
I'll be
rationales,
there too.
it helps to talk through it because remember, I don't know if I said this to you guys or it was my Monday class. Remember, Next Gen is about critical thinking, applying that critical thinking to clinical judgment. So the more scenarios, like we just did in our quiz, those are actual patient scenarios. You can memorize a book and readings from front to back, but if you can't apply the knowledge in the clinical setting, it's not going to work. Does that make sense?
It does.
That's why these quizzes are designed around, if you had a patient come in, who's the biggest priority, So, okay, next, or if you want, let's pull up your HESI prep assignment and see what we covered. Everybody know what I'm talking about, right? Nobody's going to tell me they don't know what their HESI prep assignment is, right?
Is it that checklist with the topics and the nursing guidelines?
Yep. No, HESI prep assignment, concepts in community-based nursing. It's with all the boxes.
Yeah. Isn't
Yeah.
that?
Yep. So we're now
Is that
finished
what you
with
just said?
Yeah. Oh, I don't.
Okay.
I thought you said something about guidelines. I just
Is
wanted to
it?
make sure.
It says nurse. It says nursing guidelines on it. I don't know if you can see it on my computer.
Are we able to like even
With
if
this?
we fill it out earlier,
What?
are we able to submit it?
Yeah. Whenever you get done with it, submit it.
And so the nursing guidelines, that's the signs and symptoms and like how I would intervene with or how I would deal with that population or deal with that disease.
That's what I'm looking at. Can you guys see that?
Mm-hmm.
Yeah.
Yeah.
Okay. And I need you
had
to
to print it out?
print out this one from week 1. Okay, not from week 9 when it's due. Because I told you guys this in week 1. The link to this form in week 9 is the old version. It didn't get taken out this term. That's why I sent you the updated version in week 1 in your announcement.
Yeah.
Okay, because week 9 is much more involved than it needs to be. Okay, when I updated this over break, it was after reviewing the HESI topics that were given for the last 2 terms to the students. I don't know the questions, but I know the topics. Make sense? So please don't use the week 9 form. It's too comprehensive. HESI's not covering all that. So what we have, we're done with week 3. So what should be able to be completed? And remember, this isn't a hard assignment. Okay, there is right and wrong, but just think of the nursing process. Like, for example, we haven't covered it yet, but bioterrorism on the first page. Just think anthrax incubation. Think clinical judgment. What would a patient present with anthrax exposure? And what would you do? Okay? Don't make this more difficult. I just want you to understand the topic, and think through the nursing process. I don't need you to list out A, D, P, I, E in every box.
So what it is and what should we do?
Yeah, what is it? And how would you look at the patient? Same as smallpox. What is smallpox? What might they present with? What would you do? Same with Ebola and sarin. So the sections you should be able to complete by now are page 2, the health promotion / teaching. And again, this doesn't have to be a whole paragraph for each box. This is simple knowledge that you know what each topic means, whether it's education or a condition. And what might you just think of all these things with a patient coming into your clinic, right? Okay, here they come with SARS. Here they come with COVID-19. How do I recognize conjunctivitis? Okay, it's you being able to identify what it is and how you might treat it. Got it? So you should be able to complete the health promotion and teaching section, which is a big section actually.
There's 4 of them, yeah.
Okay.
Well, 4
You
boxes.
should be able to complete and then the last section, vulnerable populations. Okay, you should be able to complete those 2 sections if you desire now. And then as we get into the next several weeks, we'll be covering all the other topics. But that's what we should be able to complete after the 3rd week. And I don't know if I told you guys, but I have no problem with you guys working in groups to do this. Whatever works. If you have a study group that meets weekly and you want to cover these topics, I'm fine with that. Whatever this is for you. This is not for me. This is your guide throughout the term to keep on top of what we're covering, because when it comes HESI time and you're not going to have a lot of breathing room, you have an exam in week 10 and then HESI in week 11. If you
Ms. Marvel.
Yeah.
I have a question.
Yeah, go ahead, Chris.
Is this the paper? Because I was just trying to look
Nope.
for a different one.
Nope.
This isn't the one.
And I only know that's the old one because I very specifically redid the directions to try and be simple.
Yeah. It has like a big paragraph on the top.
On directions. Yep.
Okay.
So Chris, you
It's
have
an
the wrong
announcement.
And that was in the announcements?
Week 1 announcement. Yeah. It was like the 2nd or 3rd attachment. So just please make sure. So Chris has the wrong one. If you don't have a big paragraph that tells you what the directions are, then you're not on the right one. If you just have one sentence on the directions, you have the wrong one. And I want you to have the right one because I spent a lot of time updating it over break to make sure it was specific to the topics that were covered in HESI. So and I took out a whole bunch of stuff.
So the vulnerable population is
last
the second to last page on the bottom and the entire page of the last page.
Yep, you should be able, we've talked about all those populations. And if we didn't cover it in depth, because of course I can't cover everything about this entire sheet, but if we haven't covered it in depth, go back to your readings and read about that population and supplement your knowledge with that. There's a method to my madness for giving you that packet in week 1. It's not to create more work for you. It's so that in week 9 and 10, you're ready to start studying with your HESI with a completed document. And you're not going, holy crap, this is empty. I have to go back and figure out when we covered this. It becomes a huge time-consuming assignment.
Yeah,
Make sense?
I've said holy crap, but not in English.
Right. So that's why it's a work in progress. And that's why I want to bring it up every week. Hey, don't forget about this. Keep filling it out.
I don't remember that.
If I may, if anybody's still looking for it, it is in the announcements. The title is week 1 announcement / information. I mean, what's that? / attachment.
Okay, which one is it?
Yeah.
It's that one. And it's
okay. Okay.
So Miss Marvel,
yes.
In regards to the practice exam, how much of that material will be on the exam next week?
In regard to what practice exam?
The one that's in on exams off.
Oh, that's just you mean the practice is just making sure that you're up to date with ExamSoft. Your settings are
Oh,
right. You know how to go in and take the
I thought that was a.
exam. That has nothing to do with exam one.
I thought it had something to do with that. Like you were
No.
trying to.
Where
Okay.
is it?
Nope. Has anybody taken it? Anybody taken the practice exam? Tell Makeda what's in it.
I'm pulling mine up right
I'm
now
on it now.
because
Yeah, it has nothing to
So
do
I
with
just
it.
see, yeah, it's just about exam controls
Exactly.
and other things that they.
Exactly.
Okay.
What I do want you to look at is your study guide. Okay. That's what I want you to look at. If you have a good understanding of your study guide, and I don't mean memorizing it, if you can apply the information into a clinical setting, clinical judgment, you're going to be A-okay. Okay, remember, this is all about application. Now, that's next gen. Taking your knowledge, taking your critical thinking, and making clinical judgments. It's a hard transition, I know. It's a hard transition. But we're all guided by next gen now. Okay. Well, that's it for me.
I got one question real quick.
Yeah,
Is there you'll be able to tell us this, but is there a lot of that Erickson or Piaget or any of that kind of stuff on there?
Is it on your study guide?
I don't remember looking through the whole thing, but
the theorists, the Puget and
I know what you're talking about.
Mhm.
I know you're talking. Is it on your
no,
study
I'm
guide?
thinking out loud. I'm thinking out loud to.
Yeah, no sweat. I'll just make sure I go through the whole study guide.
If it's not on your study guide,
Did I just lose you? Oh, okay.
Erickson is a yes. Okay, I'll stay on. I'm going to stop recording. Did everybody put their name in the chat, right?